Welcome to Medicare Simplified, a podcast by Sanford Health Plan that will help you make the most of your Medicare Advantage benefits. I'm your host, Mick Gary. Living with chronic health conditions or experiencing complex medical situations can be challenging. Getting you the precise care you need when you need it are care management professionals through a line powered by Sanford Health Plan. Today, we're joined by Barb Vandensleer, a director at Sanford Health Plan. Let's start at the ground level here, Barb. What is care management?
Well, our care management team provides case management services to our members, and that really is to help them improve their health and also better manage their health conditions. So, we really want to focus on ensuring that our members understand their treatment plan that their doctor set up, and that includes their medications and also things they can do to help just manage their health. We also provide a lot of education and support. So, support can be through referrals within our team, as well as out into community resources or other entities like pharmacists and our social worker that we have on our team. So, it's really about connecting to resources and then also just making sure that their care is coordinated and they're plugged into the right resources.
Tell us how your team can assist our listeners.
So our team is made up of intake coordinators, social workers, and then we also have case managers that are either focused in medical conditions or behavioral health conditions. And they manage our programs, which can vary from somebody coming out of the hospital after a medical or behavioral health admission, or we would focus potentially on someone with multiple health conditions or even complex conditions. And then we also have specialty programs around kidney disease, transplant, cancer, and then also behavioral health. And so we really just walk through a series of questions with individuals that enroll in our programs and really to understand best where they currently are from a health status and then also where we can best provide supports. So this could be through education and tools. So somebody should be monitoring their blood pressure. Do they have a blood pressure machine? That type of thing. We also have other programs that are available through the health plan for our insured members that are for diabetes, so diabetes management programs. And so we want to make sure that they're plugged in and are aware of those resources. And then if they're struggling in areas like transportation, food, housing, and even financially, we have social workers too that can help look for resources to kind of help support them in those needs.
Can you offer an example of somebody that you helped with a complex care situation?
A lot of times we focus on individuals that are coming out of the hospital as part of our care transition program. And so if you can imagine somebody that maybe has chronic heart condition and they're in with pneumonia or any type of respiratory condition, which is kind of right now, again, during the winter is pretty common. If you think about the person comes home on oxygen and maybe they don't have a lot of social support in the home and they're weak from being in the hospital, so they're really at risk for falls, it can be very scary. And so our case manager would reach out to this individual and really talk through their discharge instructions that were given to them by the facility to make sure that they understand what they should be doing. And also to make sure they have the medications that were prescribed. And a lot of times what we'll see is their medications will change after coming out of the hospital. And so they have pills in the home, new pills that they picked up at the pharmacy, and they aren't sure what they need to take. And so really we walk through that and make sure any of the questions that they have are answered and they know what they're taking. If there is a lot of questions, we then would potentially refer into our pharmacists that we have on our team as well, just to kind of help walk through those and kind of resolve any questions that they have. This individual too probably could potentially be needing to monitor their blood pressure and also potentially weighing themselves daily. So we would make sure that they have a blood pressure machine, a scale in the home. If they don't have that, that would be something that we could assist in helping provide for them. And then, of course, then we need to educate. And so this is where we would talk about what is normal for readings for their blood pressure and also what they should be seeing for weight changes day to day, and also when to call the doctor. And so it's important, of course. And so we want to support them also with tools to document. So we have tracking cards and different resources that we can provide to them as well. Other things, again, we've seen too when they come out of the hospital, maybe they're the caregiver for someone else in the home. They're the one that prepares the meals. So we do have options to help provide in-home meals as well. So that would be something that we would offer to them and also set up. So it could be through a program that we have or even Meals on Wheels that's out in the community. So really trying to tie back in any resources that we can find for the individual.
Is this a one size fits all, or is every plan personalized for our listeners?
So we know everybody's situation is different. And so, in what is most important to them that they want to work on as far as goals in improving their health. And so we really want to focus on what is important to our members and where they want to start. And so we look at what's most important to them first, and then we incorporate that into the plan and provide our recommendations or resources to support that. So it really is customized to the individual because we know everybody's different.
If people have questions at this point, what should they do?
If you're an insured member with Sanford Health Plan on the Align product, we would love to hear from you. You can reach us on our case management line, which is 888-315-0884. One of our intake coordinators answers the phone line and can answer any questions or enroll you in a program if you're interested.
Thanks, Barb, for sharing your expert insights on care management. If you'd like to learn more about Medicare Advantage plan options from Sanford Health Plan, visit align.sanfordhealthplan.com or find more information in our episode show notes.